In this video, I'd like to do a couple of things, introduce a couple of things. They're both related to an event that we have in Orlando. It's called the Healthy Life event. We have done it before. We did it last year, and we've got another one coming up in March. Now, most people won't be able to attend it for reasons of travel. You know, if you're in Australia or the Middle East, you're not likely to be able to come over for this event. But there's significant cost associated with it as well, and a lot of people won't be able to attend it for that reason. However, it is worthwhile that you understand what the event is and the information that we'll cover in this upcoming mini-series, because the upcoming mini-series basically is about an hour and a half to 2 hours worth of the content that was covered at the first Healthy Life Summit. First of all, what is the Healthy Life Summit? It's a time where the first time we got about 24 people together. We did all the testing, CIMT, cardiogenetic testing, lipid testing, cholesterol testing, inflammation testing. We got all of this information, and myself and other faculty members presented basics of how to evaluate this. I saw individuals as patients, and we'll do that again in the upcoming one. And we spent 3 days focusing on heart attack and stroke risk and how to mitigate it. We have people there who we do a full-blown SpectraCell investigation. SpectraCell is a way of looking at micronutrients. So those of us who are into micronutrients get a deep look at, again, micronutrients. It's been very interesting and appealing to dentists. Over half of our attendees last year were dentists. So we actually have a CME or professional licensure accreditation for dentists. Very briefly, I've mentioned this multiple times. Why are dentists so interested? Because gum disease and prediabetes go together like hand in glove. Gum disease is both causative and it's both a cause and a result of prediabetes, diabetes, and therefore heart attack. Now, if you're not interested in hearing more about the meeting itself, then you may not want to see the rest of this video. But again, what I'm going to do next is go through some of the items on the web page to help you understand. Those that are interested, help you understand the event itself. Again, for those of you who just want to hear about the mini-series is taking about an hour, 1 to 2 hours of the content from the first Healthy Life Summit and making it available as content on YouTube. I think in thinking about how this event was started, it's an interesting point. There's a fellow named David Mites. He's the only nutritionist that I know who has been a full-time public speaker all of his career. What's also interesting about David is that his dad died at age 56. Now, it's interesting, as we all know, people watching this channel, by far the most common causes of death and disability in this country and now in other developing countries, it's heart attack and stroke, cardiovascular inflammation. And by far the most common cause of that has to do with insulin resistance. Now, it's frustrating that you don't see more focus on diet and nutrition. Most folks watching this channel know that the top 3 priorities for heart attack and stroke prevention are nutrition, nutrition, and nutrition. So David, because of his unique role in life, has ended up really focusing on heart attack and stroke. I actually met David on at a Bale Dunning conference. He's very, very knowledgeable, like Doug is on the dental side. So David developed this seminar, this weekend approach. Like I said, we talk about how to prevent heart attack and stroke, but the first thing that we do is talk about how to assess your risk. Now, the grab line, the headline for the event itself is sort of in your face, but you know what? Well, let's look at it. What do you have in common with a mobster, motivator, and moderator? Well, if you live in the U.S. and or keep up with the news, you recognize these faces and know what we have with that. They all thought everything was fine too. And then 2 of the 3 died. All 3 of them had a heart attack. And look at the ages on these people: 51, 51, and 58. And for those of you who don't know, we're talking about James Gandolfini, the star of the Sopranos series; Bob Harper, star of Biggest Loser, who had a heart attack associated with Lp(a), or at least he announced that it was mostly due to Lp(a) risk. And then, although I usually am suspect of Lp(a) only, but that's something we can talk about at the event, or you can see on other videos on the YouTube channel. And Tim Russert, Meet the Press. He's a deceased poster boy for the fact that a normal negative stress test does not mean you're not going to have a heart attack and die. That's exactly what happened to him. In March of, 2008, he was having some problems, had a stress test, it was negative, breathed a sigh of relief, and then 3 months later, in June, died at work. Now, this is some other information about, just more attention, trying to get attention for the event. As an American, you're more likely to die from heart attack than any other cause. And it's more than just Americans at this point. Heart attacks and strokes are now optional, really. And that looks weird, sounds weird, but most of the folks watching this channel know that it's true. A couple of other points. It's in Orlando. It's a Hampton Inn. As you see, the meeting itself is expensive because we're actually including the CIMT, the cardiogenetic testing, the SpectraCell testing, inflammation panel, all of those. And although the space is nice, at the first one we had some construction going on. It was a little bit cramped. Now it's much better. The whole point is we're not spending money on lavish stuff, although it's nice. The weekend is intense, and there's plenty of lavish, neat things in Orlando. I suggest if you do want to come to this event and go to something else at Orlando later, you may want to just plan on spending a couple of nights here, and then going to, if you want to go to a nice Disney hotel, then do that. But just briefly read through what you'll get. The peace of mind that comes with early detection, heart health insights that'll save your life. Again, we'll go over, in the mini-series, you'll start seeing some of the things that we cover. It's a lot of things that you see on my channel. I've done some things on SpectraCell, but not very much at all. Don't do a lot of dental stuff, although you've seen Doug on it a couple of times. One thing you'll see is David and I started this debate about nutrition and diet, low carb versus exactly. My perspective is you need to be low carb, especially if you have insulin resistance, and most of us have insulin resistance, and as we get older, more do. David comes from the classic trained nutritionist perspective, and he says, but Ford, wait a minute. Brussels sprouts, cauliflower, all these things that you low-carb guys say are very, very good for you, those are pure carbs. So I think we would both agree that those are good for you, but What we don't agree on is whether they're true carbs or not. And we'll get into some of that debate. And again, the attendees usually love to join us on that debate. We get advanced genetic testing, 9p21, KIF6, 4q25, all of those things that are, again, both expensive and difficult to obtain. We do get you a significant price break. It's included in the tuition for the event, and David is very clear. If you've already had some of these, he will go over them with you and take out that portion of the tuition. In addition, he's also agreed for anybody that comes to him through my YouTube channel, he'll give a significant discount, and he'll talk with you about how much that is. So you get lots of good tasting, good for your food. Now that's one of the things, again, very interesting. David has a chef that caters the entire event. And again, it sounds like, well, you're staying at a Hampton Inn, but why are you catering? The catering is to demonstrate some of the heart healthy foods and how to have good food that's heart healthy. David is the author of a book, What Your Doctor Doesn't Tell You About Cholesterol and Why Trusting Your Physician Can Result in a Heart Attack. Again, if you've watched much of my channel, you probably have some ideas where he's going with that. And if you go to the website, www.thehealthylifesummit.com, you can just get that report for free by clicking on it. Now, I've introduced David. You know me. Janice, my wife, you may have met in a couple of videos about Shingrix. She's a health coach, and we'll be talking a little bit about how to fit all of these facts into your lifestyle, your daily and weekly habits. That is, it's one thing to learn all of the science and all of the things that we need to do that are important. It's a totally different thing to be able to incorporate all of that into your daily habits. And again, that's what Janice does. She got a doctorate in health education from Johns Hopkins and a 2-year training program at Vanderbilt on health coaching, exactly how to do this. Dr. Thompson, Doug Thompson, he's been on a couple of my videos. He founded the Wellness Dentistry Network. This is all about dentists who are focused on the fact that, again, there is an inextricable link, pardon that word, undeniable link, a link that you cannot deny or change between gum disease and heart attack and stroke risk. And there's a mechanism, by the way. There's something in between that causes both of those. Prediabetes, insulin resistance. As Doug will tell you, 90% of people will have gum disease at some point in their life. Huge portions. And again, that's not at all a surprise to me if you know and understand my perspective. And if you've read the UCLA study, they said over half of adults in age 30 and above in California have insulin resistance or even diabetes. And that was just looking at hemoglobin A1C and a fasting glucose. Now, that's not including the other tests that you need to do for like OGTT and or an insulin survey. Dan Romance and Richard Leishik are also other guys in the dental space. So here's another thing that happened, and again, I mentioned it before. We've got a companion conference going on called the Healthy Dentist Conference, and because of the popularity of this with dentists. Now, I will tell you, anytime the dentists are meeting together professionally, we will be having non-dental professional concurrent meetings. So actually, most non-dentists find the dental part very intriguing, and I can tell you they're very helpful. Way over half, sometimes up to 90%, depending on where you look, of us have had bleeding gums when we go to the dentist. Bleeding gums is a major indicator and source of risk for heart attack and stroke. Most dentists see so much of it, they don't even notice it, they don't even mention it. As you see, there's some parallels here. David found a whole bunch of good-looking dentists and made the point too. They all thought everything was fine, and then they died. So again, you'll be having some other professionals there that are focused on the oral health, and when they're talking about professional components of dentistry, we'll be talking about personal components of heart attack and stroke prevention. Now, let's go down here and talk a little bit about, if you're still with us and you're interested in details, here's the next detail, and it may be a shocker. Like I said, it's very expensive. It's $44 or $50. Now, like I said, David's able to give as large a discount as possible for folks coming in from my YouTube channel. But that, wait a minute, $44.50, that's an incredible amount for 3 days. Well, when you think about it, let's go back and look. Like I said, cardiac risk genetic testing is included. ApoA1, ApoB, small dense LDL, the full lipid panel, vitamin D, inflammation panel, oral DNA testing. Now, if you're thinking, okay, you know what? Brewer has said he's opening up his practice, and I am. And it's significantly less. It's like 1,000 to 1,500. Here's a couple of things. That 1,000 to 1,500 basically includes an hour to 90 minutes of time with me. We have some discussion later about whether or not we'll do follow-up care, writing scripts, things like that. It doesn't include any of the tests, and it doesn't even include coordinating the tests, which is the hard part. Even if you can afford getting these kind of tests, it's very difficult to find them. As we mentioned, CIMT is the classic in this area. Your docs tend to not understand prevention that well, usually, and so they tend to not know to look for ApoA1, ApoB, small dense LDL, plaque 2, inflammation panel, oral DNA testing, omega-3 tests. Yes, you do get a one-on-one evaluation with me as part of the event. As I said, you also get we'll have a CIMT tech there. They'll get the reading the next day, so everybody will have their results after before they leave. Now, as I mentioned, you have SpectraCell testing. Basically, SpectraCell is looking at some, it's all about micronutrients, and it's looking at a couple of things. For example, vitamin B6 was shown to be normal in people. However, once you look not at just serum levels, but you look at white blood cell levels, often found to be low, and giving them vitamin B6 improved their immune function anyway, even if the serum level said it was normal. Same thing with other vitamins like vitamin C. So again, a very interesting set of facts around micronutrients. Here's the faculty. David has offered to give you several of his books as a part of this. Again, this is like a boot camp environment. I'll give you an example. We bring blood strips, blood glucose testing strips, and do a lot of that testing with the individuals. And as you might predict, even folks that don't have, with some folks, we do find some have full-blown diabetes. They come back with levels over 200 and never knew it. A lot of folks that have pre-diabetic levels. And typically we'll see several people probably about 30% will say, look, you know, I had this weird number. I had 105 for my fasting um, blood glucose, but then it dropped down to 90 after I ate breakfast. That sounds counterintuitive to a lot of folks, but many of you on this channel know that they're talking about dawn effect. Many people have not even heard about dawn effect. So we have great practical information that we're able to share and see real time. Again, my channel sometimes gets a little bit researchy, academic. This meeting is 3 days boot camp style, a very, very practical approach to evaluating yourself and knowing what you need to do. I mentioned the term share. You don't have to share your information with anybody. There are usually about 80% of folks tend to share this anyway because little or none of this is embarrassing type of information. It's all cardiac risk stuff, and most of the people that are into this are not worried about sharing it. However, some people don't want to share any of their information, and you don't have to. Meanwhile, however, you will see discussion about the things that cause heart attack and stroke risk and how to manage them, how to screen for them, how to prevent them, how to manage them. If you've made it this far, again, I appreciate your patience and interest.